this lecture on protozoal arthropods and parasitic infections, we'll be talking about scabies, the pediculosis, capitis, corporis, and pubis, and we'll be talking about leishmaniasis, insect bite hypersensitivity, and commonly seen things like pedis dermatitis, and uncommonly seen larva migrans. Okay, and we'll be seeing about the clinical features. We'll be seeing how to investigate and what are the treatment options available for these disorders. So let's start with the most common protozoal infection, that is scabies. Okay, scabies is caused by Sarcoptes scabies variant humanus. Sarcoptes scabies variant humanus. So it's a mite. Okay, and it is transmitted either through sexual, like prolonged skin to skin contact, or through the fomites like bedding and clothing. So after getting transmitted, this mite penetrates the stratum corneum. Okay, this mite penetrates the uppermost part of the epidermis, that is stratum corneum, at a rate of 1 to 10 millimeter per day. Now, after penetrating the stratum corneum, it lays eggs. Okay, it lays around 2 to 3 eggs per day, and these eggs take around 2 to 3 weeks to hatch. And this mite will die after 30 to 60 days. And our body tries to react against these mite, this egg, and the fecal pellets, that is scabella. So it develops an hypersensitivity reaction to this parts, the mite, the egg, and the fecal pellets. And this hypersensitivity reaction leads to most of the clinical manifestations of the scabies. Okay, so mite, so it penetrates the upper part of epidermis, that is stratum corneum, 1 to 10 millimeter per day. And in any infected patient of scabies, there would be around only 5 to 10 mites. Okay, there would be around only 5 to 10 mites in an infected individual. And after penetrating the epidermis, the stratum corneum, it lays around 2 to 3 eggs per day. And these eggs hatch around 2 to 3 weeks. And the adult mite dies after 30 to 60 days. And it is transmitted by skin contact, and it just needs around 30 minutes of contact. Okay, or it can spread through fomites like bedding, clothing, towels. Okay, so it is spread by contact and fomites, and it takes around 3 to 6 weeks for the manifestations to develop, because this is a delayed hypersensitive reaction to the adult mite, eggs, and fecal pellets. So the body takes around 3 to 6 weeks for developing this hypersensitive reaction and for the clinical features. So the incubation period in primary infestation would be 3 to 6 weeks. And after getting cured, suppose the patient gets the recurrent infestation, it would be sooner. Okay, it will be within a span of 1 to 2 days. This is important, and they have asked this period of primary and recurrent infection in previous exams. Okay, it's 3 to 6 weeks in primary infestation, and if it's recurrent, it takes only 1 to 2 days for the incubation period. And clinically, you would see itching. Okay, itching will be more severe during the night. And what are the types of skin lesions you would see? The skin lesions could be primary skin lesions or secondary skin lesions. The primary lesion, the most important, is burrow. Okay, it is pathognomonic. If you see a burrow, and the most likely the infection could be because of scabies. Okay, as you can see, it's a serpentine. Okay, it's a thin gray line. Okay, it's a thin serpentinous thready gray or skin colored lines. What is this burrow? So the mite, after entering the stratum corneum, it is penetrating at the rate of 1 to 10 millimeters per day. So the site of entry would have scaling, and the site where the mite is at the current stage, you would see the papule or vesicle. So this is the migration of the mite. So at the site of entry, you would see the scaling, and the site where it is currently, you would see the papule or vesicle. Okay, and the length would be around 1 to 10 millimeters. Site of entry be scaly. The current site would have papule or vesicle. This is because of the inflammatory reaction. The second primary lesion is papules or nodules. Okay, you can see there are multiple nodules in the penis. Okay, in the penile shaft of the glans penis, and you can see it also on the scrotum. Okay, this is because of hypersensitivity reaction. And what could be the secondary lesions? Secondary lesions could be secondary infection, like in bacterial infections we talked about impetiginization, secondary impetiginization, which could be because of scabies, dermatophytosis, or pediculosis. So if there's scabies, there could be secondary infection, or it could lead to eczema. Okay, eczematization. So these are the primary and secondary lesions. And what would you have? The patient would have itching more severe during the night, and there would be more family members affected. Okay, and what are the classical sites of scabies? Okay, you can see these burrows. You can see these burrows on the hands. So where could you see it on the hands? You can see in the finger with spaces. You can see it on the sides of fingers, or you can see it in the flexor aspect of the wrist. You can see it in the finger spaces or in the sides of fingers, or you can see it in the flexor aspect of the wrist. And you can see also between the interdigital clefts of the toes, that is in the feet, or in the genitalia. In genitalia, it's mostly seen in the males. You can see in the penile shaft or the scrotum. And where would you see this papules and nodules? Papules and nodules are due to hypersensitivity reaction. And where would you see this? You would see it in the elbow flexures, the axilla, around the areola, in the abdomen. In abdomen, it could be in the periumbilical region, or it could be in the genitalia or groin. Okay, so the imaginary line connecting these points, that is axilla, the elbow flexures, the ants. Okay, elbow flexures, ants, the genitalia, abdomen. Okay, this imaginary line connecting all these points form a circle, and this is called circle of Ibra. It's an imaginary circle. Okay, circle of Ibra. And what are the sites spared in adults? Spared sites in adults would be face, palms, and soles. You would see the finger spaces involved, but the palms and soles would be spared. And these sites could be involved in infants. Okay, could be involved in infants. And there are certain variants of scabies, like Norwegian scabies. What is Norwegian scabies? It is seen in immunocompromised patients or patients who do not have any self care. So, seen in immunocompromised patients like patients with HIV, In psychiatric patients who don't have self-care. Okay, well, what would you see? You'd see crusting and nodules. Okay, severe form of scabies, it's crusted scabies or Norwegian scabies, and you would see crusting and nodules throughout the body. More commonly seen in the axilla, elbow creases, the abdomen, and the groin and genitalia. And another variant of scabies incognito is because of change in morphology because of steroids, topical steroids. So the quacks or scabies is not properly diagnosed, and the patient has only impetiginization or excimerization. Mostly practitioners would give steroids, and this steroids could change the morphology and could lead to scabies incognito. And what could be the complications? The complications could be secondary infection, the pyodermas caused due to Staph aureus or Streptococcus pyogenes, or it could be eczematization. And we saw streptococcal infection with nephritogenetic strains could lead to post streptococcal glomerulonephritis. Okay, and how would you investigate the patient? Mostly, the diagnosis could be attained clinically. Suppose you have a doubt, then what would you do is you gently scrape the papule or the burrow, and you take the scraping and you put it in the slide and add KOH or normal saline. You would see the mite, the eggs, and Sibella, which are the fecal pellets. Okay, this is one form of, this way you can diagnose it. Okay, so you can see this mite of scabies, or in recent years they are asking what is the dermoscopic appearance, okay, of scabies. Dermoscopy, what would you see? You'll see jet with contrail appearance. Dermoscopy is a handled non-invasive instrument which would magnify the lesions. And dermoscopy, you would see the jet with contrail appearance.